I am struck by how well the county, the city, the state, and the region work together on tough, complex social problems. I am very proud that we are the open door. We are the place that's available 24 hours a day, 7 days a week. The lights are always on, and our emergency room sees the health implications of virtually every social problem we face as a society.
Domestic violence knows no boundaries, regardless of race or religion, ethnicity, nationality, income level. We find it throughout our communities, throughout our state, throughout our nation. No family is immune from the potential threat, the harm, the destruction of domestic violence. Many of you know that in 2008, my cousin Kathy was killed by her estranged boyfriend, shot in the neck in front of 2 Montgomery County police officers who in turn took his life. And no father should have to bury his daughter for such senseless, tragic acts of violence. No family should have to suffer that. Fiscal year 2010 data shows that the Hagerstown City Police logged over 1,500 responses for domestic violence, and that's a 12.5% increase in the number of domestic violence reports from 2010 to 2011. Those are some of the most dangerous calls that a police officer or a sheriff have to respond to. It's a domestic violence call. And there have been 9 known fatalities since 2006. These numbers are much too high. That is why today I am very excited to announce that your state, we, together, are going to establish the 6th domestic violence screening and referral program, hospital-based program here at Meritus Health Center, and that's what today's announcement is. We're going to commit $50,000 through the Governor's Office of Crime Control and Prevention, and we're partnering with Care First, who is going to commit an additional $16,000. That, coupled with the resources here at Meritus, the support of our local officials, we are going to make a huge difference in saving the lives of victims of domestic violence. When we set it up at Prince George's Hospital, and we'll do the same thing here, we're going to measure this. Everything that I'm saying is somewhat intuitive. The idea that, yep, victims present in the hospital, we have trained people, we'll make a difference. But if you don't measure the effectiveness, then a year from now, 2 years from now, we're going to maybe ask ourselves, is it really making a difference? So we're measuring this. And when we do, when we complete our work, and we can demonstrate that we're not only saving lives, but we're lowering the cost of health care, we're going to be able to import this, export this, adopt this in every hospital in the state of Maryland.
The tragedy and the impact of domestic violence is associated with higher rates of health care utilization, chronic physical and behavioral disorders among victims and the family members. Research suggests that similar domestic violence victim service programs reduce the likelihood of future hospitalization, reduces misdiagnosis and unnecessary treatment, and of course addresses chronic conditions and mental health disorders that are exacerbated by domestic violence.
I'm Pam Holtzinger. I'm the coordinator for the Forensic Nurse Program here at Meritus, and I just wanted to take an opportunity to explain a little bit about how we are going to partner with this in this training program. Originally, the program was called SAFE, Sexual Assault Forensic Examiners, and we found very quickly that sexual assault didn't happen itself in a vacuum, and domestic violence was a big part of that. So this training program will provide us as forensic nurses the ability to be key people to be able to go out and train other professionals, to be able to recognize and also have the tools and resources to be able to intervene and mitigate the bad outcomes from domestic violence. We're very grateful to be part of this as part of the larger team, as Vicki said, and I would like, on behalf of Meritus, to thank the Governor's Office and Care First for considering us, and I truly am honored to be part of this. Thank you.